Hello, I'm José Bastos. I'm the CEO of Knok Healthcare. This idea came up 1 year ago when my 5-year-old son got sick, had to go 3 times to the same hospital to be seen by 3 different doctors, and got 3 different diagnoses for something that ended up being a flu. We were very uncomfortable about this, and so we thought there must be something we can do. And so basically we started studying a little bit of the healthcare system, and we realized that healthcare has been drawn in the 19th century and has not evolved very much since then in terms of processes. And 40% of the ER visits actually could be avoided and should be avoided because people are waiting long times at hospital unnecessarily. And we thought we must do something about it. So we decided to create Knok Healthcare, which we are launching right now. So please download our app from the App Store. It's available from scratch. And I think that the way we should present this is basically by calling a doctor and show you the doctor calling experience that we have. So let's see. This is our map. And we see an available doctor there. I'm positioning him here. And, well, he costs 75 euros. He's a psychiatrist. We all need that, being in a startup. And so let's just say I got a fever and say, come on, join us, and let's see what happens. Okay, so we'll wait. Let's just get him here. All right. We'll wait. Maybe we'll have a surprise. I forgot to pay. Damn it. And so now I pay on app because we don't want doctors to carry around money, and we estimate that he'll arrive in 12 minutes. So in the next pitch, we'll interrupt. So let's wait. Okay, so coming back to us, we're launching. Please visit our Facebook page, download us. And why do we think we're a cool app? Because we save time, we're very comfortable, people will go to you. It's a proximity doctor, the doctor will probably be the same over and over again if you wish him. So it's really cool, 3 taps you've seen, you get the doctor to you. We have a great business model. Insurers are able to save, patients are able to save, doctors will make a lot more money than they used to do in hospitals. So really, we get a flat fee per appointment. It's really simple, and we trust that we're getting a lot of traction. From doctors we already have, let's see how it works out with patients. Why now? Basically, patients are really looking forward to get to control their health. Healthcare industry is really strong, and we believe in massive scalability, worldwide potential. So there are a lot of markets. We're in CUF as well here in Portugal for support to our doctors. We will not leave you standing. Thank you.
Thank you very much.
Available on the App Store.
Great. Prepare your questions, but I have just one. I noticed something that you have a bug in your application.
No.
Yeah, if you have a fever, do you call a psychiatrist?
The bug is in me, not in the app.
Okay.
You're right.
Okay, so any questions for Knok? No? I will start with a question. We have a question here. We need the mic for now, but coming. Go ahead.
I'm sure this is probably one of the #1 questions you always get. How do you go about getting doctors on this? Are they normal general practitioners that have their own office and they set aside hours to do house calls, or they just full Knok doctors, or even just getting them on board seems?
We're getting them on board. We have hospital working doctors. We have hospitals that have doctors that have their own practice. Most of them are doctors that work in hospitals, and during the time that they're not in the hospital, they basically turn themselves on at the app, and they are available for everybody to see.
Like an Uber driver.
Exactly. Only a doctor, a very qualified professional, certified by the doctor's board.
Yeah, of course.
Next question comes from me, actually.
All right.
Okay. Okay, sorry. Go ahead.
Hi. Why is it different from my insurance service or Saúde 24 or some? Where's the value? Because it's a bit more expensive. I don't know if the price is that one. But why is it different from my insurance service?
Because you get to choose the doctor, because you get to actually see the curriculum. You choose the person, you see on the map in real time when he's coming. When you get one of those services you call a call center, and you get whoever comes whenever he's available. And our doctors, when you see them on the map, means that they're available to come to you immediately.
How many doctors do you have, country?
Actually, we already have 40 doctors on board, everything signed formally. We're in the point of growing our network, and at this point we have 114 doctors that are in the process of being onboarded in Porto and Lisbon.
And what's your scaling strategy?
Well, basically, we've been studying, and the 20 largest cities in the world in 10 years' time will generate 65% of the world GDP. It's a market that for house calls, if rates of house calls are stable throughout the world against the present, it would be a market of around 300 million euros of net profit, charging the kind of fees that we charge. So basically the idea is to grow city by city in Europe and see where it leads us.
If somebody has a question, just lift your hands. Okay, we have a question there.
My sister is a doctor, so I want to know at lunch when I phone her how much money she can earn more entering your system.
If she works at a hospital, on average, the doctors that we are onboarding will make 5 times more per appointment that she does right now. And all she has to do is go to our website, subscribe our I'm a Doctor section, and we'll come back to her.
So I already know my Christmas present to her.
All right.
Another question there.
How do you, okay, let's say I see a doctor in your app. I see that he or she works at that hospital. So isn't it cheaper if I go straight to the hospital or her doctor's
When you have like 5 hours waiting time to be seen by a doctor in an emergency room, he will not be able to bypass you into the hospital. So the thing is, he'll join you in 15 minutes versus you go to the hospital and you wait 8 hours.
Sorry. So let's say how is it different? Okay, I need a doctor now.
Yeah.
He cannot
download
bypass
the app, you can call. There's 4 of them online right
okay,
now. Okay,
but then how does it work? I need him now. I see on the app.
Yeah.
But he cannot bypass me at the hospital, it's true. So
but he's not at the hospital right now. If he's available, it means
he's
he
not
can
at
come to you right now.
Okay, thank you.
One last question.
Thanks. I think it's a great initiative. I mean, I personally applaud it, but I think it's probably at this point only affordable to those who actually have the money to pay. Of course, and then healthcare is, a big issue across many countries, and so I was wondering whether any thoughts already on how you can make it actually scalable, but also scalable towards people who may not have the funds to pay every time they want to see a doctor right now.
Thank you for the question. 2 things. We work on a reimbursement scheme with insurers, so on average, anybody who has a health insurance will probably receive a reimbursement of 50%. And on scalability terms, we've been getting a lot of traction from assistance insurance who manage actual doctors' networks. And what they say is they would like our app to work like a co-branded thing, so the name of the insurer powered by Knok, so that they would be able to manage their own doctors for their own clients. And obviously that would give us massive scalability at a very low marginal cost. So we're very hopeful that it works out.
Thank you very much for Knok. Round of applause.
Guys, and you see, it works. Here's the doctor. This is Philippe. Great. Thank you.